We also wanted to make sure that we had as many options available, so the neck deck can be used in the seated position. Again, this is a progressive device. It allows the progression from very, very mild extension, where the patient simply puts it in a chair and has their head bent backwards at a light pressure against the posterior structures. They may do that for a few days to gain access to an accommodation of the stretch of the structures. They then add some inflation to the device to add a little lordotic enhancement, a little more stretch, and finally they can put the forehead strap on and pressurize into the full posterior translation and extension and then increase the inflation. We also find that there are patients that simply don't acclimate to the lying position for whatever reason, and the intimidation of laying down and getting their head back is too much for them. This seated option is very beneficial. Also, it's important to note that many cervicogenic headaches can be quelled by the use of ice. We know this. When we put ice in a compressive mode with slight extension, we find a dramatic improvement in cervicogenic headaches. And we recommend for those patients that have cervicogenic or tension headaches to put an ice pack on the inflation device against the back of the neck, put the forehead strap, and then mildly inflate it so we get a compression ice against the posterior structures with the pressure on the forehead. It will knock out headaches very quickly and easily in a lot of patients. This is a pre and a post x-ray. Again, consistency and proper methods help restore the lordosis. Haphazard, overly aggressive methods aren't going to help, especially if the patient is injured or is fearful of them. This is a pre. You can see how on the pre-x-ray this is a clear military neck with a slight kyphosis at the mid-cervical regions. The weight bearing is clearly at the discs. We notice disc thinning taking place. With transition from both office to at-home use, we find that the lordosis has been restored to close to 30 degrees over a period of about 90 days. Now, cautions and indications or contraindications. It's important to understand that extension traction is a patient choice. Over the years, there's been this notion in patient management called a patch versus fix. If a patient chooses to be patched up and wants a few sessions or a few treatments, give them that. That's what they want. To force them into fixing their spinal structure is as bad as trying to force somebody to quit drinking, quit smoking, or to exercise. If they don't want to do it, they will not do it. So it's a patient choice. You build the case for the importance of this and let the patient make the decision. Another reason is there will be discomfort in most cases, or in many cases, with extension, especially if done too aggressively. That's why the neck deck is a progressive, comfortable device that allows transition from no extension to more extension. And again, a break-in period is necessary. Again, we look at FABQ, which is called Fear and Avoidance Belief Questionnaire. It's important to recognize when there's psychological problems or impediments to therapeutic interventions. Patients oftentimes, if they've been in pain long periods of time, will be very scared and fearful of doing things that might cause them discomfort. Encroachment syndromes and stenosis are important to understand. We cannot misinterpret. Extension can be beneficial, but it isn't for everybody. The foramen size closes and posterior bulging can occur in some cases, and any kind of peripheralization of symptoms, severe dizziness, vertigo, or these sorts of post-extension maladies need to be seen as contraindications. Also, patients' age. We are not looking at the very elderly population to put into extension because most of them are suffering with stenosis and potential spurs also that could be pressurizing into the posterior neurological elements. High blood pressure and nausea or vertigo, dizziness, these things need to be looked into too. If extension is too aggressive, it may occur. If you break in, you can oftentimes find most patients are tolerant of extension though. So finally, the neck deck is a simple and effective option. It's low cost, it has a high perceived value, it's easy to use, and it's an ideal initial extension unit. For those of you who are into extension traction, I think it's going to be an excellent adjunct to what you're now utilizing. It will allow you to have that transition and it will allow you to get those patients that may have been too perturbed by the more unencumbered extension devices to find comfort and to be able to work into the more aggressive units. And of course, it's perfect for both home and office use. Thank you for your time and attention.